Energy for being here, and the ICS organizers for giving us the possibility to speak in the Japanese Parliament. It's a great honor. So, I'm Panagis Polυκρέτης. I'm a PhD in structural biology, and I'm going to present the autoimmune inflammatory reactions caused by COVID-19 genetic vaccines. So, on February 28th, 2023, in my country, Greece, a head-on collision occurred between two trains at the Tempe Valley in the Thessaly region. The collision happened between an intercity passenger train and a container train, killing at least 57 people and injuring hundreds. The intercity passenger train had been allowed to proceed on the wrong track, traveling in the opposite direction of the container train. The passenger testified that he heard the train driver say, "Πάμε και βουλή." That means, let's go and wherever it goes. This is something that could never happen in Japan, despite the fact that you have thousands of trains moving each day, some of them reaching speeds of 600 kilometers per hour. And this because you have an amazing technology, dedication, attention in everything you build, as well as a deep sense of responsibility, and you care so much about the security of your passengers. The words, "let's go and wherever it goes," in my perspective, reflect what happened with the mRNA vaccines against COVID-19. And I will demonstrate it, citing peer-reviewed scientific articles from everything I'm going to say during the next minutes. And in the end, I will deposit this document to the Japanese Parliament. I'm not used to read my presentation, but in this case I will do due to the importance of the presentation. So, during the pandemic, the pharmaceutical companies used emergency regulatory pathways to accelerate the introduction of the genetic vaccines into the market and to avoid crucial pharmacodynamic, pharmacokinetic, and genotoxicity testing that are standard procedure for gene therapies. However, the mRNA vaccines and gene therapies share some common technological foundations, particularly in their delivery mechanism and cellular processes. Both approaches involve delivering genetic material into cells to produce therapeutic proteins, and I'm citing Party et al. 2018. The speed at which the genetic vaccines were developed, manufactured, and released was presented to the public as an achievement made possible by the scientific progress of the pharmaceutical industry, working in partnership with global governments for a greater good. However, quoting the words of the recently retired head of the Vaccine Research and Development Department at Pfizer, Dr. Catherine Johnson, "We flew the airplane while we were still building it." The words, "we flew the airplane while we were still building it," and I'm citing Kingwell 2022, somehow reminding the words, "let's go and wherever it goes." Even though some scientists were trying to warn the scientific community about the absolute need of biodistribution studies, the pharmaceutical companies avoid doing such evaluation in humans by using the tactic of classifying genetic vaccine as conventional vaccines. And I'm citing Polυκρέτης 2022 and 2023. However, a biodistribution study performed by Pfizer on rats and submitted to the Drug Regulatory Agency, first released by Japan's PMDA, showed that the lipid nanoparticles containing the mRNA accumulate beyond the injection site. And I'm citing the Pfizer study number 185350. Based on the findings of the aforementioned study, the community assessment report by the European Medicines Agency, dated February 19th, 2021, on page 47, states, I quote, over 48 hours, distribution from the injection site to most tissues occurred. Therefore, the EMA, as well as everyone who had received the study number 185350, was aware that in rats a biodistribution beyond the injection site was occurring and that it was involving, I'll quote, most tissues. Despite those alarming signals, billions of people have been inoculated with these experimental genetic vaccines. In my perception of things, this sounds like let's go and wherever it goes. And now I will explain you using very simple words why it is fundamental to perform biodistribution evaluation for the genetic vaccines. Why you are able to predict that if you are holding a pen and you let it go, the pen will fall to the ground. Due to the widely known laws of gravitation. Am I correct? As in physics, the universal law of gravitation is a basic principle. In the same way, in immunology, the antigen presentation process is a long-known and basic principle. And due to the principles of the antigen presentation process, every human cell that synthesizes a non-cell or foreign protein is destined to be recognized as a threat by the immune system and killed. And I'm citing Kotsias et al. 2019. And this leads to a very easy to understand but crucial issue. If the vaccine-derived genetic material spreads beyond the injection site, other tissues, much more important and vital for the organism, can be affected by autoimmune reactions against self-cells producing the vaccine-derived spike protein. And I'm citing Polykretis et al. 2023. Unfortunately, there is plenty of evidence that proves that the vaccine-derived genetic material can persist in the organism for extended periods of time. And I'm citing Bansal et al. 2021, Jonker et al. 2021, Verdi et al. 2022, Rodgen et al. 2022, entering in the systemic circulation and reaching even body secretion like milk. And I'm citing Hanna et al. 2022 and Hanna et al. 2023. This allows the vaccine-derived genetic material to reach a wide variety of tissues, causing the synthesis of spike protein and triggering severe autoimmune reactions. And I'm citing Baumeier et al. 2022, Motz 2022, Schwab et al. 2022, Nushida et al. 2023, Yamamoto et al. 2023, Sano et al. 2024. Between those tissues, there are even terminally differentiated and essential for life ones, like the brain and the heart, where it causes severe and deadly inflammatory reactions characterized by the infiltration of lymphocytes. And I'm citing Choi et al. 2021, Gill et al. 2022, Mortz 2022, Schwab 2022, Nushida et al. 2023. In the study of Nushida and co-authors, it is described the dramatic case of a 14-year-old healthy and athletic Japanese girl who died just 45 hours after the administration of the third dose of the Pfizer vaccine. The histopathological data show infiltration of inflammatory lymphocytes in the heart, the lung, the liver, the kidney, the diaphragm, the stomach, the duodenum, and the bladder, and she died from cardiopulmonary arrest. The risk of myocarditis following mRNA vaccination has been acknowledged even by the CDC, and I'm citing the clinical consideration by the CDC 2023. And the active surveillance studies by Mansangwan and Guerguin, which are the most reliable types of studies, show that 2.3 and 2.8% of the participants respectively developed myocardial injury upon vaccination. And I'm citing Mansangwan et al. 2022 and Guerguin 2023. All this exposure to severe autoimmune reactions occurred in order to take a genetic vaccine which protection not only wanes in time, but even turns to negative, as it has been proven by the retrospective cohort studies by Hematelli et al. 2022 and 2023, and Shrestha 2023. And all this for a disease that has an infection fatality rate of 0.0003% in the age group 0-19, 0.002% in the age group 20-29, 0.011% in the age group 30-39, 0.035% in the age group 40-49, 0.12% in the age group 50-59, and 0.5% in the age group 60-79. And I'm citing Pezzullo et al. 2023. So, considering all the above-mentioned facts, which rational person would ever conclude that the benefits outweigh the risks? And I focus just on the autoimmune adverse reactions, without mentioning the risk of cancer, of thrombosis, and all the other adverse events associated with these experimental genetic vaccines. In fact, a study that analyzed the excess mortality in 31 European countries found that there is a linear correlation between the vaccination rate and the excess mortality, and I'm citing Armstad and Stein, 2023. The same concerns exist even for the replicon genetic vaccine Act 154, which shares a similar technology with that of the mRNA vaccines, and I'm citing Hope et al. 2024. So please, protect your people, and don't let it go and wherever it goes. Make your health system perfectly efficient, rational, and functioning like your public transportation system. どうもありがとうございます。